Welcome back. David in Gastonia, North Carolina. You are on the air with Igor.
How you doing, Tom? Igor? My question was, I'm already on disability. I make probably about $17,000 a year. Is anything going to change with my Medicare?
Are you on Medicare or are you also on Medicaid?
Medicare only.
You're on Medicare. Okay. For you, probably nothing is going to change. I don't imagine. If you're getting coverage through Medicare now, you will continue receiving coverage come October 1st or January 1st when Obamacare actually goes into effect and people start seeing coverage. Since you're on Medicare, for all those millions of Medicare beneficiaries, they're going to continue receiving the same benefits they always have.
And that's...
All right, thank you.
Thank you very much, David. Thanks for the call, and thanks for watching Free Speech TV. And so, Igor, that's just true right across the board. That if somebody's on Medicare and that's their principal or their only source of health insurance, don't worry, be happy. You don't have to do anything.
That's right. The cuts you heard so much about during the 2012 elections, the $716 billion in Medicare cuts, those are cuts that are on the provider side, and the law specifically prohibits any reductions in coverage to beneficiaries.
So nothing's going to change for the people who are receiving Medicare. Period.
That's right. Now, but to be clear, things change in the healthcare market all the time. They changed before Obamacare, and they're going to continue changing after as the kind of market adapts and businesses adapt and make certain kinds of decisions. So it's hard to promise that people aren't going to see any kind of changes, but they're certainly not going to be dropped from their plan because of anything specific in Obamacare. Things may change in how the Medicare package is calculated sometime down the road, as it has for years been changing and evolving.
Sure.
So that's really just the nature of the deal.
Now, what about people who are buying the Medicare supplemental policies, like are offered by, I think the largest in the country is United Healthcare's. They do it through the AARP. Those policies that fill in the holes in Medicare, are those going to change?
Those aren't going to change either.
Those are not going to change either.
That's right.
So Obamacare does not affect those. And then the caller asked you or you asked the caller rather, if he was on Medicaid as well as Medicare. How would that change the equation?
Well, Medicaid itself really changes in many ways. The prediction is that by 2024, I believe, you're going to have, which is a 10-year window, you're going to have 24 million people in these exchanges, these state-based marketplaces. But you're also going to have 13 million in Medicaid, which is the state-federal partnership program that has for years been providing coverage to low-income Americans. Obamacare stretches the eligibility and allows far more people in. But of course, since that Supreme Court decision, states now have the option of not expanding their Medicaid coverage. So in some states, there's going to be a small sliver of the population as a result of that decision who are going to have a tough time, unfortunately, finding affordable coverage. They're not going to have the Medicaid option, and they're not going to qualify for subsidies within the exchanges.
And that's kind of an in-between between desperately poor and just poor, is that?
Yeah, that's where it is. And in those cases, they'll specifically be told when they're enrolling that they don't have that option because the governor or the legislature in that state turned down Medicaid.
Amazing. Igor, hang on. We'll be right back. Thank you. Igor Volsky. Welcome back. Thom Hartmann here with you. Igor Volsky taking your calls on Obamacare. What does it mean? How does it affect you? Joe in Glencoe, Illinois. And by the way, Igor's blog is over at thinkprogress.org. He's the managing editor of the whole blog, but he's the expert, one of the country's experts on health insurance or on Obamacare rather. And he wrote the book Howard Dean's Prescription for Real Healthcare Reform. Joe in Glencoe, Illinois. You're on the air with Igor.
Hi. I was calling because there was a good article this summer by David Moberg in Indies Times that outlined some strengths and weaknesses of the program. The strength being that if you're healthcare coverage as an individual is relatively limited to 10% of your income. However, if you're provided with an option through your employer and you turn it down, you won't be eligible in the exchanges, and there's no caps on what they can charge for dependent care coverage. So if you're offered an option at work that has extremely high cost for dependents, it's going to make healthcare possibly unaffordable.
Yeah, that's really a regulatory problem that came about because the law wasn't specific enough. You know, you'll remember when Obamacare was passed, there was a House version, a Senate version, and then we all thought it'd go into a conference committee and they'd come together in a unified bill. That didn't happen. Scott Brown was elected in Massachusetts, and so you never had an opportunity to kind of work out some of the quirks in the law, and that's one of them. And they tried to fix that problem in the regulatory process, and they weren't able to. And so now you do have this issue where the coverage that you get for your dependents doesn't count towards that cap. So, you know, there are going to be some problems like that. More are going to be uncovered as people start signing up, and what eventually I think will be needed is a legislative fix to take care of this thing. But you know, advocates have always said that Obamacare is kind of a starter home, and you're going to have to add on and make changes and adapt as you see, you know, how to improve this thing. But that's certainly a problem that advocates have been pointing to for a long time.
Okay. Jimmy, and this is, you know, just to forgive the politics, but it would be so nice if the Republicans were talking about fixing small things like this in the program rather than, you know, doing 21-hour filibusters to defund the whole thing. Anyhow, Jimmy, you're on the air with Igor Volsky. Jimmy in Berryville, Arkansas.
Hello.
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 Hello. Your question?
Yes. Say you're just a nominal human being, and you haven't been paying health care over the years, mainly because you couldn't afford it. Okay?
Right.
Hello?
Yeah, no, we're listening.
Okay. You know, you can't afford it. And now, all of a sudden, you've got 30 million people now are subject to being forced to afford it, whether you can or not. And now, excuse me, I think that maybe the people that want to sell insurance are just looking at this and they're going, now just how many more people can we catch? Because the truth is, when it comes to the medical industry, a person can have $1.5 million worth of medical bills, and
so, Jimmy, your point is that this is a boon to the healthcare industry or the health insurance industry. I think everybody agrees on that. Although their profits have been capped by this program, they weren't before. But I'm curious, if you don't mind, what's your annual income?
Oh, about 14,000.
Okay, so Igor, how much is it going to cost Jimmy to buy Obamacare now that he's being forced to by the government?
Well,
I have no idea.
Yeah, you know,
well, Jimmy, hang on. Let's ask Igor and let him tell you.
You're right. The $1 million in healthcare costs accrue very, very quickly, particularly if you have a chronic condition, you're in an expensive accident, and that's why the need to carry a health insurance is a critical one, because you don't want to pass those costs on to the system.
Right. So we've got Jimmy here. He's 55. And he's making around $15,000 a year down in Arkansas. How much is it going to cost him to buy Obamacare?
The average premiums that were released just last week would probably suggest that given his age, given his income bracket, he's going to be able to go into the exchanges, he's going to qualify for subsidies, and will probably be able to find coverage that's between about $150 and $350. That's just the general average.
Per month or per year?
Per month.
Now, what if he doesn't have $150 or $300?
Well, then he would find a policy that's cheaper. The policies again go
At
by
an income level of $15,000 a year, isn't he fully subsidized?
Yes, the subsidies at that level will certainly be far more. How much he would pay at that income level, I can't tell you. That it's the calculations there require a calculator, and he can go to Kaiser Family Foundation or Tuesday to healthcare.gov and figure that out, because the subsidies are directly pegged to your income. So the math there, I can't do over this phone
Right.
call.
Okay. But my understanding was that somebody with that level of income, because that's sort of at the poverty level in the United States.
I'm sorry. Now, I should have clarified that those numbers, that range I offered, is probably not for someone at his income level. Those are general numbers that we've seen, averages that we've seen that the government has put out.
Because my understanding is with the subsidies, somebody at that income level might end up paying $15, $20 a month, $30, $40 a month, maybe at the high end. Or?
Yes, that's. I mean, it would depend on many factors, but that generally sounds plausible.
Okay, all right, Jimmy, have we answered your question?
Well, I guess.
Okay, Jimmy, thanks a lot for the call. I appreciate it. Thanks for listening. We'll be right back. It's 28 minutes past the hour. We've got news at the bottom of the hour, and then Igor Volsky will be back taking your calls 5 minutes from now on Obamacare. Stick around.